Assalamu alaikum wa rahmatullahi wa barakatuhu. For those of you who are joining in today's webinar, mashallah, uh, titled Fertility Awareness. So this webinar will look at four things: your cycle and your body, and the three fertility signs, how to observe and record your fertility signs, and also tips for balancing your hormones. We have a special guest speaker joining us today, my dear old friend, Muna, also known as Hamza. She's currently the director of online learning at Amani Birth, and she's a certified doula, childbirth educator, and pregnancy and family health coach. I know Muna, mashallah, is very well informed, very well resourced lady. She holds a master's degree in international education policy from Harvard University, and she has supported women and girls in education, in personal development, and well being for over 20 years. It has been an honor to know her personally, mashallah. We were just talking about our years in Riyadh, and inshallah, let's enjoy this informative, insightful webinar. Muna, over to you.
Thanks so much, Iroda. MashaAllah, Jazakallah khayr. So before we begin, I'd like to start with dua, inshallah. Bismillah ar-Rahman ar-Rahim. Wa salatu wa salam ala Rasulullah wa ala alihi wa sahbihi wa sallam. Allahumma alimna ma yanfa'na wa anfa'na bima tu'allimana wa zidna min fadlika ilman wa ta'liman. Innaka ala kulli shay'in qadir. O Allah, teach us what is beneficial for us and cause us to benefit from that which you teach us, and increase us in knowledge and instruction from your grace. Surely you hold power over all things. Ameen. Alhamdulillah wa shukrullah. Assalamu alaikum wa rahmatullahi wa barakatuh. Everyone, I just look at the comments here. Just make sure I can see what people are saying. Okay, alhamdulillah. So let's get started, inshallah. Hopefully everyone can hear me fine. So today's talk is about fertility awareness, specifically the fertility awareness method, inshallah. So before we start, I'd like to ask what your intention is for joining today. It's really important that we get, an idea of what everyone's purpose is for attending this webinar. So if everyone can just type in the comments, I can read a few of them here. What is your reason for joining today? I don't know if the comments are working. Inshallah, I was hoping I could get a little interaction from the viewers. Okay, I'll just wait another minute to see if any comments pop up, inshallah. So one person said family planning, someone else said my period is not regular. So perfect, inshallah. Those are good reasons for joining today. So we'll be touching most specifically on family planning and a little bit on normalizing hormones, inshallah. Someone else said some months are normal and some are long. Someone else said to learn about perimenopause and continued support for fertility. Okay, mashallah. Thanks so much for your comments. Someone said, please talk about PCOS. So I will clarify what the scope is for today. Inshallah, you'll still stay in, for the whole webinar, but we won't be able to cover everything in detail just because we have a short time. But I'll try to touch upon some of these things, inshallah. So the main scope of this webinar is to learn the basics of the fertility awareness method. And the focus will be on avoiding pregnancy. So this talk will not be focused on trying to get pregnant. I know some people are trying to conceive. Someone just said trying to conceive and balance hormones. So we won't be focusing on avoiding pregnancy today, but when you see what I'm showing you, inshallah, you can see how it's very easy to apply what you learn towards getting pregnant as well, inshallah. So thanks so much for those who commented. Thanks for sharing, mashallah. So let's talk about why the fertility awareness method. Okay, why should you be learning this? So the first thing is that it's easy to learn. So why not, right? Once you learn the basics and start applying it, FAM is really easy to implement, especially for those who do have the regular cycles. If you have irregular cycles, it's a little more tricky, but you can still apply what you learn, inshallah. The other thing is empowerment and having the ability to make informed decisions about your own body. So you'll know yourself so much better. You'll have so much more information that can help you, as well as your husband, plan together when to have the quality time together, when not to. You'll also have a better idea of your health based on your fertility pattern, based on your hormonal pattern, and then you can make better decisions when it comes to medical treatments or interventions that your doctor suggests. Okay, or maybe you want to seek out more natural interventions from a naturopathic doctor or an herbalist or someone like this. So you need information to be able to decide what you should be doing. Also, you can avoid invasive procedures and artificial hormones from other birth control methods. You can avoid them completely if you're able to apply FAM correctly, inshallah. And it's low cost. There's hardly anything to pay except maybe, which we'll talk about later, a thermometer or perhaps printing paper. But pretty much the concepts are free to implement. And it's easily reversible. Once your circumstances change and you actually want to conceive, or vice versa, you can immediately change. And then you already have an understanding of your pattern, so you can time the things optimally either way. Okay? Alhamdulillah. So let's go very quickly through some of the birth control methods that are available today. Okay, so for women, there's so many, right? We have tubal ligation, IUD injections, the pill, the ring, the patch, and all these other things. Diaphragm, female condom, cervical cap, sponge, suppository, spermicides, films, foams, jellies. The list goes on, right? And these are color-coded, so the red ones are much more invasive than the rest. The others are a little bit invasive, but not as much as these. The purple ones for sure cause hormonal issues, so they'll upset your hormones, making it difficult for you to balance your hormones naturally if you're doing any of these. And then the blue ones, they do have some risks, but mainly they're inconvenient. For the diaphragm, female condom, cervical cap, and sponge, you have to plan ahead, right? Do you know if you're gonna, be having quality time tonight or not? You have to know ahead of time. So it kind of ruins the moment, the spontaneity that normally happens, right? And these other things, suppository, spermicides, films, foams, and jellies, also, they're kind of gross, right? You don't want to be sticking things up there that don't need to be up there. For men, this list is much shorter. You have vasectomy, which is red, also very invasive, the condom, and withdrawal. So just an interesting note is that women, we're only fertile for a short time every month, maybe about a third of the month, right? Or a quarter of the month. Yet men are actually fertile all the time. But most of the methods focus on the women's body, trying to control the woman's body. And a lot of these are very risky. Side effects and physical ramifications of some of these methods, many of them involve the increased risk of blood clots, like the hormonal ones, strokes, breast cancer, irregular spotting, severe pelvic inflammatory disease, uterine perforation, heavy crampy periods, urinary tract infections, cervical inflammation, possible allergic reactions, and so on. So there's so many things that, so many risks to doing any of these. Even the most, even the condom, the cervical cap, they can damage the cervix, right? So there's a lot of things that could be happening here. For men, of course, vasectomy is not reversible. What if they decide they want to have kids later? It's probably not a good idea. But we're going to be focusing on the symptothermal method of natural family planning. So we won't be talking in detail about out there just because we don't have time. Okay? And so the symptothermal method is the most comprehensive and reliable of all the natural methods. The reason being is that it observes at least 2 out of 3 primary fertility signs. There's also some secondary signs, which I can talk about later if we have time, but we'll be focusing on these primary signs, inshallah. When applied correctly, that means no cheating, It's as effective or more effective than the pill or the male condom, subhanAllah, with a very small failure rate. Failure meaning you get pregnant in this context. You know, it's not really a failure, that's qadarullah, but just in the context of it didn't work out, right? So if you follow it correctly, mashallah, very, very small chance of getting pregnant. So before we talk about what you're going to be looking at for those signs, let's just do an overview of your whole cycle and your body. In order to use FAM, you have to understand your menstrual cycle and what's going on in your body during that time. So here's a quick overview of what's happening during a typical cycle. So every cycle, the follicle stimulating hormone, or FSH, this the green line down here, it stimulates around 15 to 20 eggs to mature in each ovary. So you have 2 ovaries, right? So in both of them, these eggs are coming out to mature. Each egg is encased in a follicle, which matures, and it takes about 2 weeks for the egg to release, but it could range from 8 to 21 days or longer. So the time for ovulation is called, this before ovulation is called the follicular phase, right? So this, you can see here, the follicle is growing until it gets released. And the hormones involved are before this line here where the ovulation occurs. So the main factor that determines how long before you ovulate is how soon your body reaches an estrogen threshold. The high level of estrogen will trigger an abrupt surge of luteinizing hormone, or LH, which is this darker one here. So you can see the brighter red one is estrogen, is increasing because the follicles are releasing estrogen. So as they mature, more estrogen builds up, and that triggers the LH, which is this darker red one, to spike. Okay. So then when the LH spikes, the egg passes through the ovarian wall, usually within a day or 2. Then after ovulation, the egg actually goes out into the pelvic cavity where the fimbria, which are finger-like projections in the fallopian tube, they sweep it up. And that's where the egg will wait in that tube for about 24 hours to be fertilized. So the egg can only wait for 24 hours. After 24 hours, it dissipates, it's gone, reabsorbed, and you will no longer be able to get pregnant. So it's just a 24-hour period, literally, where the egg can be fertilized and you can get pregnant every month or however your cycle is, okay? Following the release of the egg, the follicle that held the egg collapses on itself and becomes what's called the corpus luteum. So the egg has released and gone into the tube. Meanwhile, in the ovary, you have this thing here called the corpus luteum. So what happens here? It starts producing progesterone, which is this blue line. So you can see progesterone is really low. Then after ovulation, it increases. It reaches the highest point. Now, if you were to get pregnant, it will stay high. But in this case, the person didn't get pregnant, so then it decreases. And as it decreases towards the end of that phase, which is called the luteal phase, the corpus luteum becomes a corpus albicans, which is sort of like a little scar that's left inside your ovary. And the scar lasts for about a few months, and then it goes away, alhamdulillah. So then at the end of this, the woman, she will menstruate again, and the cycle repeats, right? So it repeats every month or so. So what else is happening in the uterus? So at the same time as what's happening in the ovaries, in the uterus, the lining, which is called the endometrium, is shedding in the during menstruation. You can see the little red symbol here showing that it's shed. And then during the proliferative phase of the uterus, it's starting to build up again, okay? After ovulation, it builds up again to this sort of maximum level. And then it starts, if you don't get pregnant, it starts to get shedded during the menstruation, right? And so you can see the uterus cycle, it corresponds to the ovarian cycle, with the menstrual and proliferative phases here happening during the follicular phase. And then the secretory phase happens during the luteal phase. So they're all lined up. Everything is happening together, alhamdulillah. You can already see there's so many signs to let you know where you're at in your cycle, right? What else is happening? So a bit lower, you have your cervix, which is the opening between your vaginal area and the uterus, right? It's that kind of, it's like the gateway. So the cervix, before ovulation, it's firm, low, closed, and it's dry. At ovulation, so that's only 1 to 2 days before or just that day of ovulation, really. It's soft, high, open, and wet. And then immediately after you ovulate, it closes again and becomes firm, low, and dry. Okay, so that's another sign that's happening here. And so this happens through every cycle as well. Your temperature is also affected by the hormones throughout your cycle. So you can see here immediately after ovulation, progesterone, it actually produces heat in the body. So your temperature will actually have a shift. It will rise and it will stay high for 12 to 14 days or so until before the next menstruation, right? If she stays pregnant, so if a person gets pregnant, this temperature won't go back down. It'll stay high. That's how someone can tell they're pregnant without doing any tests if they're tracking all these signs every month. So the temperature goes up and it stays high if pregnant. If not, it will drop when the progesterone level drops. The temperature also drops, and then she will have her next menstruation. And so if it stays elevated past about 18 days or so, and the woman has been active, then she would probably be pregnant, most likely, unless she has a fever because she's sick or something like that. And so the length of the cycle can vary from person to person and month to month. But in this example, it's a 28-day cycle, sort of the typical cycle, and the ovulation is on day 14. And that tends to be a myth. So like if you go to the doctor's office, they always assume that, let's say you're pregnant, that you must have conceived on day 14, because that's when you probably ovulated, and they'll calculate your due date and everything based on that number, even though your cycle might have been longer. And so this is why due dates aren't really that accurate, but that's another, that's like a side point. So in any case, the generally from 21 to 35 days is normal for a cycle. Something much shorter or much longer isn't as normal, but it can happen because of other factors, right? And so the follicular phase, so that is the phase before ovulation, that's the one that tends to vary because of stress or, you know, more exercise or whatever's happening. It might delay the ovulation past the norm. So that tends to be the variable time, the variable phase. The phase after, which is the luteal phase. So after ovulation, that phase almost always is about the same for every woman in every cycle, normally between 10 to 14 days. And it doesn't vary that much unless there's something happening that's affecting her health, for example. So a woman who's having a very short luteal cycle, which is usually defined as being under 10 days, she probably has fertility issues and it'll be difficult for her to get pregnant. So this is where hormones are so important during your cycle, right? If she has a longer one, it's really unusual because that doesn't tend to happen, because that the corpus luteum, the one I showed you earlier, that only has a lifespan of up to about 16 days. So it doesn't tend to last longer than that. It'd be very unusual. So usually being shorter is an issue. So you can see that the timing of the ovulation is really what determines the length of your cycle and not so much what happens after it. It's usually what happens before it. Okay. Everyone's good with that? No questions so far? Okay, so let's review very quickly, recap the hormones that are involved. So we have the follicle stimulating hormone, or FSH. And then we have estrogen, very, very important hormone in fertility. And we have the luteinizing hormone, or LH. These three hormones play a huge role leading up to the ovulation. So turning point is ovulation. After ovulation, all those hormones drop, and it's the progesterone that's rising. So during the luteal phase or secretory phase, progesterone rises again, stays elevated for quite a while, a week and a half almost, and then drops before the next menstruation. So you can sort of remember that with this acronym FELAP or FELIP, not sure how to pronounce it, FEL, and then the O is the ovulation, and then P. So these are the main hormones that are involved in your monthly cycle. So now let's look at the 3 fertility signs. What are these 3 signs? We have cervical fluid, waking temperature, and cervical position. They were all mentioned when I showed you a typical cycle earlier, right? Oops. I clicked on something by accident. Okay, here we go. So cervical fluid, what's that all about? So cervical fluid is actually the substance necessary for sperm nourishment and mobility. It plays a huge role in whether or not you're going to get pregnant. A huge, huge role. Something that we tend to overlook and not really think much about is actually the main player happening here. Just like sperm is not just the actual sperm, it also has all the liquid and everything to help the sperm swim. For females, our liquid, so our fluid, is actually also helping the sperm get to the egg, right? So you can see here, this is an illustration of what infertile fluid looks like. And the sperm is trapped, right? If you look closely, it has this weird kind of caged-like or net-like shape. The sperm can't swim in it. So what happens if you have infertile fluid? The sperm dies within a few hours. It can't survive. It'll be trapped there and eventually it just dies. So you won't get pregnant, or you're very unlikely to get pregnant when you have this kind of fluid. Meanwhile, this is what fertile fluid looks like. It's an illustration of what it would look like up close. You can see it's sort of more like these long strands. It's very smooth. So the sperm can swim forward and glide through it, right, in the fertile fluid. And sperm can actually live for up to 5 days. So you could potentially have intercourse 5 days before ovulation and nothing after that. So it's 5 days before, and you might still get pregnant because of that sperm that's swimming there. And interestingly enough, the female sperm is actually more resilient, but it's heavier and slower than male sperm. Male sperm is more fragile. It doesn't live as long, but they're faster. So you can actually time your intercourse to increase chances for either a girl or a boy, which we won't go into a lot of detail, but it's just something to keep in mind. It's interesting. Someone asked the question, so what if you have egg white fluid straight after you finish your period? So it's likely that your follicular phase is quite short, and so you might be ovulating very soon after that. But if it disappears, then it could just be a residue from your period. So it could just be a period type fluid that's not colored, like not red. And then you might become dry soon after. So you'd have to track yourself for a couple of months to make sure what your pattern is, inshallah. Okay, so we've looked at that. Now, let's take a closer look at what kinds of cervical fluid there are, what types there are. So we have dry or nothing. And with that, you'll feel dry at the vaginal opening. That means when you wipe yourself, it's kind of dry. The tissue would stick, right? You don't feel wet down there at all. Someone said female sperm, not sure what you mean. So sperm carries either the X chromosome for a female or the Y for a male. The female egg is only X, right? So you need an X and a Y for a male to produce a male child, and XX to produce a female. That's just based on the chromosomes. And so the female sperm, what we're saying is the sperm that's carrying the X chromosome. If it fertilizes an egg, it would be a girl. And then the male sperm carries the Y chromosome. When it fertilizes the egg, you'll have a boy, right? So the sperm that carries a female chromosome X are heavier and stronger, but they move slowly. And then the sperm that carries the Y chromosome actually are lighter and swim faster, but they don't last as long. They're not as resilient, which is interesting. So that's what I mean by the female sperm. Not that women have sperm. No, it's the female chromosome sperm. Okay. Wayaki. Okay, so you have dry or nothing, and you would feel dry as well in the sensation down there. And then we have sticky. So sticky, it's like now if you were to wipe or touch, you might see something. You might actually have something, but it's a dry, sticky feeling. It either feels dry again or it's very sticky. Okay, but it's starting to be more moist than just nothing, right? And then we have creamy, which is sort of like a lotiony feeling, and it's wet, moist, and sometimes you feel cold, like you actually feel it's a bit cold down there. And when you wipe, it's kind of wet and moist, but it's not slippery just yet. Okay, and then we have egg white. So egg white is wet and lubricative. So down there would feel, if you wipe with a tissue, it will glide really quickly and very smoothly, right? Like you have this very slippery, wet feeling. And this is sort of the pattern up through ovulation. So usually after a menstruation, the woman will transition to having dry or nothing, maybe for a couple of days. Then it'll get sticky, then creamy, and then egg white. There's usually this sort of transitional sticky and creamy until you reach the egg white stage. So Amara's saying, oh, Sister B said, I'd also wonder about the female sperm. I thought I missed an important lesson at school. Yeah, sorry. All the sperm is from the male, but it's that each sperm carries a different chromosome. And Amara said, each sperm doesn't carry both. No. So the egg, the woman's egg carries only X, and then it's the sperm which carries either X or either Y. And I think I can't quote it exactly, but I think there's actually a Quranic verse that indicates the male determines the gender of the baby. I can't quote it exactly though. I remember reading about it somewhere. Yeah, so each person, either the egg or the sperm are only carrying one of the chromosomes that determines gender. Okay, so back to cervical fluid. So we have this sort of continuum here. You're going from dry to sticky, creamy to egg white, and this is the pattern that you'll see every month. What about on your underwear? So if you get sort of this dry or even creamy on the underwear that's not very wet, it makes sort of a squarish or rectangular pattern on the underwear. This is if it's enough that it actually gets onto your underwear. Whereas the egg white type, the very wet, lubricative fluids will make more of a circular shape because it has a really high water content. So that's another thing you can look out for. If you wear pads and stuff, however, like a panty liner or whatever, you wouldn't see this as much because usually panty liners have those weird patterns, like a texture on them. So if you're using fabric ones, the reusable fabric ones, you're probably okay, or just the plain underwear, you might see this, inshallah. What about the texture and stretchiness? So this is what you would see if you actually held some of the fluid in your fingers. Okay, so you might be rubbing it around like this or opening it like this to see how it stretches. Okay, so rubbing it and opening it like this. If you guys can see my camera, I don't know if you can see me. Okay, so if it's dry or nothing, you might feel something. You might feel something when you touch down there, or if you insert your finger lightly, there might be a dampness, but it evaporates right away. So Fatima asked, is this what we call white discharge? So the white discharge is more likely the creamier one, inshallah. But so for dry or nothing, the dampness evaporates. And then for the sticky one, it's sort of pasty, crumbly, gummy, springy, it snaps or breaks. So if you're using your finger and you stretch it, it will break right away. Or when you touch it and rub it around, it's kind of crumbly. It's very dry. Or it might be a little springy, kind of like glue when it's dried and you peel it. It has that kind of texture. Then we have the creamy one. It's kind of like lotion. If anyone uses lotion, it's usually kind of white and a little bit thick and milky, but it might be clumpy. It might be springy. So it might have a little bit of that springy, snappy feeling as well. And then when you open your fingers like this, it might stretch a little bit, but then it'll break before you reach like an inch or so. Less than an inch, it'll break. It won't stretch much. Okay, and this is where you tend to see more of the white creamy looking fluid. It's totally normal to see this every month. So some people mistakenly think they must have an infection or something if they see this. As long as it's not smelly or a strange color, like greenish color or something, then it's probably your normal creamy fluid. After that, it'll transition into the egg white kind, which looks exactly like egg whites, clear. When you stretch it, it might stretch really long, like up to a few inches. Sometimes when you sit down to use the toilet, it's actually dripping out of you and stretching all the way down. I don't know if everyone's seen that. Sorry if it's too much information, but sometimes it's like stretching all the way down, like really, even really long, like this long sometimes. Or it feels like water. It's almost like a water gushing out a bit. So each person's slightly different. You have to see what yours is like. And so this one is usually clear. It's not white. It has that clear look and very stretchy and slippery. When you touch it, it's very, very slippery. So this is the optimal fluid for getting pregnant. So the sperm will live in it and swim straight into the uterus and get to that egg, right? So that's something to be aware of. Okay. So you might be wondering, well, what about other fluids? So what if you've had intercourse with the husband and he's ejaculated, and so there's some sperm still there? Or you're aroused, you guys engage in like foreplay or touching, and you're like in the mood, right? And so sometimes you get more wet down there. And so you can do something called a water test, which, I mean, don't use a glass of water that you drink from. Reserve a separate glass for this test. So cervical fluid tends to form a blob that sinks in the water. Sometimes you see this in the toilet, like something came out when you use the toilet. It just, when you urinate, it might just fall down anyway. When you look down, you see like a little blob that's just kind of floating around. So it'll float around or sink, but it won't dissipate. It won't dissolve. Okay. Whereas seminal fluid, so that's the male semen, or other vaginal secretions that are meant to, prepare you for intercourse, for example, those will dissolve in the water. So it's not cervical fluid, okay? And so you can kind of test that out. And there's some tricks you can do, like doing a few Kegels to kind of get your cervical fluids down so you can observe it better. Or if it's after intercourse, you can do some Kegels to help kind of push the semen down to get it out so that you can observe your fluids later. So yeah, I was just looking at the comment. Yes, it happens. So how do we chart this? So let's get straight into the meaty stuff here. So this is sort of a typical chart, what it looks like. Okay, so this person has filled in what she's observed in her fluids. So let's look at each thing here. First, she has her menstruation, which she drew like a big dot. You can also color code it. So you can color code like making big red dots. Let's say you have spotting. Instead of a dark dot, you can draw a circle with a dot in the middle or a few small little dots, whatever works for you, right? But basically a symbol here for menstruation, these dots. Now she had 5 days of dry. So she didn't see anything and it felt dry. She drew this little horizontal line, sort of like a dash in each box. And then she had these sticky days. So she had 2 days of sticky here. So she filled in the box completely. She kind of shaded it in. So it's here corresponding to period, spotting, dry, or sticky, right? So she filled it in completely. And then next she had 2 creamy days. And so now she's filled it up 2 levels. And over here says creamy. So you can just look across here. Creamy. And then she had 2 days of egg white. And so here's egg white. She's filled it all the way up to the 3rd level. So you can see the progression going up here visually, which is really nice. And then immediately after the 2 wet days, she saw sticky again. So she again filled in just 1 box here. And then a whole bunch of days of dry, which she put the dashes until after that she had her next menstruation. Someone asked, does going to the toilet or doing a ghusl straight after intercourse lessen your chances to conceive? Yes, it can, if it's immediately after. So if you're trying to conceive, you might want to actually lay on your back with your legs raised. You can just be like holding it up towards your chest, sort of like fetal position a bit, or just up, whatever's comfortable for you, and wait for like an hour to give a chance for the sperm to swim up, where it needs to go, and try not to do like Kegels or squeezing, like just stay alone, like just stay there for a bit before you get up. It just improves the chances, not guaranteed though, but for sure getting up right away using the toilet can lessen your chances. because everything is coming out and coming down due to gravity, right? Okay, so now she recorded her dry days. So now let's look at the other things here in this chart. You can see she wrote down what she felt at the vaginal opening. So that's where you're wiping and seeing how you feel, right? So it was dry, sticky, wet, 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 and then lube for 1 day, and then dry, dry. So you can see she had very brief description of the vaginal sensations here. And then here, this is when you touch it, look at it, squeeze it, or whatever. She wrote down the description of what she saw. So you can see dry, dry for all these days. She didn't see anything. It was dry. And then she got white, sticky, moist, sticky, sticky in the morning, creamy in the evening. She put sticky AM, creamy PM, right? Wetter, white, creamy. So they're all creamy, but there's a different range of creamy. Then she has 1 inch streaked clear. So it was white and clear streaked. Then she had 2 inch. The 1 inch and 2 inch means how long it stretched when she stretched it out. And then it says 2 inch clear slippery. So that was her most lubricative day. And then the next day it went back to white sticky film. That's her dry day again. And then totally dry for the rest of the cycle. So this is sort of a typical pattern that women might see every month, right? And how she recorded it. And you can see here, she wrote down PK, which stands for her peak day. The peak day is the last day you saw your most wet fluid. So you have to note that down. It's a very, very important thing in terms of interpreting this data when you're doing family planning, right? Okay. Oh, did anyone have any questions about that? You'll probably need to practice doing that a few times yourself if you plan to use this method, inshallah. So waking temperature, the second sign. Why do we do that? It confirms ovulation. So it's something you notice after the fact, okay? So how do you confirm ovulation? So this person has tracked her temperatures for 31 days. We can see she circled the temperature here with an open circle, right? For most of them. And then once she noticed that there was a temperature that was at least 0.2 of a degree above the highest of the 6 that came before it. Okay, so she noticed the shift. You can see it visually as well, right? Suddenly she was taking her temperatures. So she had her menstruation and then it stopped and then she took her temperatures and then it was quite low and then suddenly it spiked up here. So she can see that visually. Whoa, this is the one, okay? But it has to be at least 0.2 degrees, so 0.2 above the highest of the 6, which is this one. Once she identifies that one, then she will shade in the 6 temperatures before that shift. So here are the 6. So you can see it's like shaded in compared to the others. And then she will draw a line. You can see the line drawn across. That's 1/10 above the highest one. So this is the highest one, and which is at 97.6 degrees. And she's drawn a line at 97.7 degrees. So it's all the way across here. And then this is what it looks like, okay? What she's recorded in her temperature. So keep that in mind, inshallah, because this will come into play later when we look at the rules that you follow. And so here are the tips. How do you take the waking temperature? You have to have slept for 3 consecutive hours. So if you sleep at midnight, for example, then you have to sleep past 3 a.m. to get an accurate reading. Or if you sleep at 10, then it has to be past 1 a.m. and so forth. If it's longer, that's okay. The main thing is it has to be at least 3 because that gives you a chance for your body to settle down and reach its basal temperature. Sarah Sheikh says, Umanel, how much chances you have to conceive while suffering from PCOS? So we'll talk a little bit more about that later, inshallah. Sarah Sheikh asks, can we get this chart template somewhere? It's more succinct and easy to use than a live scene. Yes, so I'm going to share resources at the end of the webinar, inshallah. Okay, so 3 consecutive hours of sleep and no activity before you take your temperature. So no talking, sitting up, using the toilet, moving around, doing anything at all. You have to just grab that thermometer and stick it in your mouth and get your reading, inshallah. And I'll talk a little bit about the thermometer later as well. Then it should be about the same time daily, give and take maybe an hour. So you don't want it to be doing it at 3 a.m. one day, then 7 a.m. the next. Your temperature reading is not in the same context anymore, so it won't be accurate. So you want to be roughly the same time daily. Your body is reaching that temperature every day, right? Every night, that is, inshallah. And then if you have any abnormalities, let's say you got sick, or as Muslims, we don't do this, but some people who drink alcohol, for example, that raises the body temperature. Maybe you had something else that you ate, like more chilies than normal. I don't know, anything that makes you abnormally hot. Note it down just in case. But otherwise, the temperature should be pretty accurate, inshallah, as long as you're following these tips. And the thermometer. So the basal thermometer is not the regular one you use that you're checking, to check your kid's fever when they're sick or anything like that. It has to be one that goes to 2 decimal places, so it's more accurate. And you should be able to read the temperature off the thermometer. So there are some out there that are more expensive that are for like syncing to an app on your phone or something like that. So I actually don't recommend those. Just get a nice basic one where you actually read the temperature and then write it down yourself. It's much better that way, because some of those ones that connect, they automatically try to predict using like a program, and it's not always accurate. It's not always good. So it's better to observe your signs and interpret it yourself. Okay, so Sister B said, do you check BBT during the period? You can, but there's sort of a cheat where you minimize the times you do it to just feed it, like a week before ovulation, and like when you start seeing the fluids, to up until your next period or up until you see the shift. It's better to do it every day, but moms, we get busy sometimes. We take shortcuts. Not always recommended, but after you've charted it many times and you're quite regular, then you might be able to sort of do a little bit shortcut so that you're not having to do that every single day. But you can also check during the period. I would recommend doing that at first until you get the hang of everything and see your patterns, inshallah. Uma now asks, what's the purpose of this chart? Sorry for the question. You'll see later, because we're going to bring it all together at the end and you'll see exactly what the purpose is for, inshallah. Okay. And so having an accurate thermometer that goes to 2 decimal places, having a backlight might be useful so you can actually see the temperature at night and write it down real quick, for example. Also having a memory feature so you can recall the temperature later. Like, let's say you took the temperature, but you didn't have time to look at it. You can check it later and get the temperature that you took in the middle of the night. And then you can keep it like next to your bed. So as soon as you wake up, you can just grab it and take your reading without moving or going anywhere, right? So side table, or I used to keep mine like right under the mattress. So I would just reach down and pull it out, take my temperature, and then stick it back in. So I didn't have to move very far. Also, you might want to set an alarm if you don't tend to wake up at the same time every night. So if you're used to waking up for like Fajr or Tahajjud, you might naturally wake up anyway, and you don't need the alarm. But just to be on the safe side, you can set an alarm for the same time every night. Okay, so what about cervical position? What's that all about? So this one is actually optional. It is a primary fertility sign, but most people don't want to be feeling up there or down there rather all the time. You don't want to risk infection or disturb the area, right? But it is useful because if your thermal shift isn't obvious, maybe the shift is very slight, then this is a sign you might use to just double check that you're infertile. Maybe you've charted a few months and you realize it's actually hard to interpret your observations. Your cervical fluid and your temperature ones aren't 100% clear to you. So you can also chart this just to be sure. And then if you are in a situation where you really just do not want to be getting pregnant for whatever reason, then this is an additional confirmation that you're in your infertile days. So you can be 100% sure you're not having intercourse, for example, when you might be fertile, right? So just additional confirmation. So it's useful. You don't have to do this every month or all the time, just depending on what you're facing. So some people, they're generally avoiding pregnancy, but if they were to get pregnant, it's not really a big deal either, right? But some, it's just like absolute, they don't want to get pregnant right now for whatever reason. Maybe they're in school or they're about to make a big move or whatever it is. No judgment here. Okay, so how do you check this? So you would actually have to, put a clean finger up there and feel around. Usually the middle finger or the pointer finger might be the longest finger, so you can actually reach it. So before ovulation, it's firm, low, closed, and dry. When you're touching in there, it feels like the tip of your nose. It's kind of hard in that way. It's like a little mini donut. If you've had children, it'll be a little bigger. If you never had children, it would just feel like a smaller one, right? Like it's not open at all, but it'll be stiff like your nose. So it's infertile. If you feel it's firm, low, closed, and dry, you're infertile. Then at ovulation, it gets soft and it's higher and it's open and wet and it feels more like your lips. When you touch it, it's more squishy like the lips and it's very moist. Okay. Mama asks, we check temperature right after we wake up without moving. Can we do underarm or must be mouth? Mouth is more accurate, I think, and easier. But you could try underarm. I've never seen underarm. Some people actually do vaginal. They actually insert it in the vagina to get like a very, more accurate temperature. But mouth is fine. You can try underarm. I've never really heard of women doing that. Usually that's used for children. But I think underarm might be okay. It's usually good when you're checking fever. The main thing is to be consistent. So you don't want to switch from underarm to mouth or anywhere else. Just use the same method every single time, inshallah. Okay, so back to this, the ovulation time, you're fertile, it feels like your lips, and it's moist, wet, and soft, and high. So SHOW, which stands for show, right? And then after ovulation, almost immediately, it becomes firm, low, closed, and dry again. So just by checking this, you can tell if you're fertile or not. And it's relative, right? It's your first time checking yourself, you're not really going to know what you're feeling just yet. But once you feel the change, the difference between the closed and dry and the open and wet, and also the height of it, then you'll get to know yourself. Someone's asking when the session will end. So we have at least 15 more minutes, inshallah. So I'm going to hold off on answering some of these questions for now, just so we can finish, inshallah. Okay, so you're looking for softness, height, opening, and wetness when you check for the cervical position. It'll take a few tries to get the hang of it. Just make sure you wash your hands with soap so it's clean, and you're not introducing any germs or anything up there, inshallah. But again, it's optional. Not everyone needs to or wants to check this regularly, but it can be useful. So how do you chart this? So when it's low, closed, and firm on the chart, you will put a little dot at the bottom of the rectangle here, and you just draw like an F, which stands for firm. Okay. And then when it's midway, partly open, and medium, you'll draw a medium circle in the middle of this upper rectangle, and you'll write an M underneath. And then when it's high, open, and soft, you draw a bigger circle at the top of that rectangle and an S underneath here. So this is what it would look like on the chart, inshallah. So let's put it all together now. This is what a complete chart would look like. It's a little bit far away, but we're going to zoom in, inshallah, to see what it looks like and what are the rules that you're going to apply now in order to avoid pregnancy. So this talk was more focused on natural contraception and avoiding pregnancy, inshallah. Okay, so we zoomed in a bit closer. Hopefully you can see. So the first rule to follow, now that you've charted everything. So someone's charted their temperatures, they've charted their fluids, and they've charted their cervical position here. And you can see it's a little bit small. It's down here, right? So everything's been charted. So the first rule, first 5 days, it's safe to have unprotected intercourse. So this is without using anything, any birth control. It's safe the first 5 days of your cycle if there was an obvious thermal shift 12 to 16 days before. So you have to chart the previous month too to know this. Obviously, for Muslims, it's haram to have intercourse during menses. But let's say someone has a bit shorter cycle. Maybe some people only menstruate for between 3 to 4 days or under 5 days. Then they might be able to use this rule. Otherwise, it doesn't really apply to most of us if we're having a menstrual period of over 5 days, right? But it might apply to a few people. Someone asked if the cervical position can be guessed by a mirror. No, you have to touch it to feel it as well, inshallah. Okay, so what's the next rule? So here's the dry day rule. So after your menstruation, but before ovulation, every evening that you feel dry, so this is completely dry, not sticky, it's safe to have unprotected intercourse. But the next day is potentially fertile if there is a residue. That means it might mask the semen from the husband, might mask the cervical fluid. So to be on the safe side, it's better not to have intercourse if there's residue until it clears up, and then the next day is dry again, then you can go ahead. So this person had 5 days of dry, so she could have intercourse all those days and feel pretty safe that she won't get pregnant, inshallah. Okay. And again, this is someone who's charted and knows her cycle as well. It's not the first time charting. She's charted before. So she has a good idea of what her pattern's like, right? But this is the rule for those dry days. Okay. Now we have 2 rules. The peak day rule. Remember, we noted down the peak day for the cervical fluid. It's down here. And there's another one written up here. So on this peak day, you would count 1, 2, 3 after the peak day. And on that 3rd evening, then it's also safe to start having unprotected intercourse without the risk of getting pregnant, inshallah. So that's the peak day rule. And combining that with a thermal shift rule. So when you're taking temperatures, remember we said with the shift, and then you count the 3 days. So the shift is here. It matches the day after the peak day. And then there was 3. You look at 3 temperatures after peak. And so if they stay high past peak day, then again, that confirms that it's safe to start having the intercourse, inshallah. However, you have to make sure the 3rd temperature is at least 0.3 degrees or 0.3 of a degree above this cover line that was drawn. That's really important. Why? Remember, the temperature indicates your progesterone level has increased. Progesterone increase actually prevents another egg from being fertilized. So it will actually, it's like a signal to your body that that's it. One egg has been fertilized if you're pregnant, and no other egg can get fertilized. If you're not pregnant, again, the progesterone still increases just in case you got pregnant, right? And so this has to be 0.3 or 0.3 above the cover line. If it's below that, so if it doesn't reach 0.3, it drops below that, then you would start counting from that again another 3 days and making sure the temperatures stay higher. That's just to be on the safe side, inshallah. Okay, so these are all the rules that allows you to avoid pregnancy and avoid birth control, while if you follow the rules exactly, then you can really minimize the risk of getting pregnant. And obviously, all of this has to be communicated with your husband because he has to understand that you're following this. Otherwise, he might be upset that you're not, allowing certain activities at other times. So let me just read the questions real quick in case there's anything relevant now. Where should we put our finger in the vaginal opening? Yes, you have to insert it into the vagina to feel for the cervix. The cervix is the thing that opens up when you give birth. So the baby comes out of there. It's inside the vagina. It's not outside. The clitoris is on the outside. Sarah Sheikh asks, is the cover line same for all women? No, the cover line is specific to you. Everyone's basal temperature varies. Some people are a bit cooler. Some people are warmer. And every month it might be slightly different as well. So it's not the same for every woman. It's based on your temperatures to set that cover line. And again, it's a reference point that you're using to interpret your temperatures to know that you've ovulated and that you can then have intercourse. So in summary, only 12 days of 28 are safely infertile days. Is it 12 days? we've got, I think it's a bit more than 12 days. Anyway, we'll check, inshallah. So out of 32 days, I think 10 are infertile. So let's go to the next slide and you'll see. Okay, so what about the fertile days, right? So here the fertile days are marked off. So fertile phase is not where you're fertile the whole phase. It's the phase where you do not want to have unprotected intercourse in case you might get pregnant. It doesn't mean that you will definitely get pregnant either on the whole stretch of that time, right? It's just a reference point. So you know, these are the days you should not be having unprotected intercourse if you're trying to avoid getting pregnant. So what do? You can abstain, which is the most effective, 100% certainly. You won't get pregnant if you abstain. However, you could do other things, right? So you might not have intercourse, but you can still be intimate. You can still have date night. You can still cuddle and be affectionate. Just don't go all the way during that time. Or some people choose to use a barrier method. Just keep in mind there's a chance of failure. There could be a hole, it could break, something could slip depending on what method you're using. So just watch out. And so someone who's strictly trying to avoid pregnancy, abstinent is the way to go. But if you're just generally avoiding, but it's not a big deal, then you can use barrier method, right? Inshallah. So you can see from this, to answer that question, it's about 10 days out of the whole cycle where you do not want to be having unprotected intercourse. You would either abstain or use a different method. And just keep in mind, you can be intimate in other ways besides, sex, right? There are other things you can do besides vaginal sex is what I mean. All the other things that are halal, you can do that. Just to avoid pregnancy, you don't want to go all the way, right? Now, you can have up to about, depending on how long your menstruation is for Muslims, of course, those days are out. You wouldn't be having sex those days. But non-Muslims, some of them still have sex on those days. And this method, other people use it as well, right? So it could be limiting to a few days before the fertile phase, depending. Like if your cycle is more like 7 days, it might only be 2 or 3 days where you can go unprotected. However, to be really, really cautious, some people actually, until ovulation, they will either abstain or use barrier method. You can still engage in all the other activities, as I told you. And then only after the ovulation, then they'll have unprotected up until their next menstruation, right? So that's another way you can do it, just to be on the safe side. Just if you're trying to figure out these, sometimes it's a little tricky, the cervical fluid in between the menstruation up until this, depending on how long your menstruation is. So to be on a safe side, you might want to avoid. But this time after, depending on how long your cycle is, you might be having at least 11, 12, 14 days, maybe up to 16 days, depending on how long your luteal phase is. A bit shorter than that, actually, because there's 2 days after here. So let's say that's 8 to 14 days. You might have 8 to 14 days that you have time to be intimate without using anything, and it's perfectly fine. And then you'll get your menstruation after. And of course, if you're still taking your temps and everything, if you suspect a pregnancy, your temperature will indicate if it's lasting, if it's staying high for long, then you'll have a better idea if you're pregnant or not, right? Inshallah. So that's pretty much all the rules you need to apply this. In a nutshell, this was really short webinar to cover all of that. If you have irregular cycles or maybe a unique situation, you're breastfeeding or something like that, then you probably need to look further into it to get more details on how to interpret irregular data. This is a very regular cycle here. Okay, so very quickly, we're going to have some tips on balancing hormones. So someone said, I see now, sis, they are both infertile before ovulation and after. Yes, so your period minus the fertile days are the infertile days. Exactly, inshallah. Cycle days minus fertile days equals infertile days. Yes, you want to be mathematical about it. So you can have about half your cycle where you're pretty safe to engage in intercourse with your husband without any protection or anything, and you'll be very unlikely to get pregnant. Remember, you're only able to get pregnant literally this one day where fertilization can happen, but the sperm can last for 5 days. But we're just trying to be safe here, right? If you're trying to avoid pregnancy. Obviously, if you're trying to get pregnant, it will be the exact opposite. You're going to be trying to have as much intercourse as possible during the fertile phase. right? If you're actually trying to get pregnant. So you can see how just by charting, you can go either way very easily. So how about balancing hormones? The best thing is, of course, having optimal health. Your hormones are a reflection of your health, your overall health. They're all linked together. And some things that lead to imbalance are poor nutrition, lack of movement, lack of sleep, stress or environmental issues, and having an unhealthy weight. So all of these have to be examined if you're having irregular cycles. Nutrition is number one. Avoiding trans fats, artificial flavors and colors, high fructose corn syrup or other added sweeteners, and junk food in general. You need to cut down if you're having issues. This could be causing it or contributing to it. Instead, eat mostly whole, nutrient-dense food and organic whenever possible. Because those pesticides, well, guess what? They interfere with hormones. They're endocrine disruptors, okay? Stay hydrated. A lot of people don't drink enough water, and I mean water, not chai and coffee and all those things, right? Which are high in caffeine and often high in sugar and other things that are added to it. So stay hydrated. If you want to look further, there are some herbs that are very useful in balancing hormones. So those of you who asked about PCOS, the diet is the number one thing that can help in PCOS and other fertility issues. And then there's some herbs that have been researched or have been used traditionally in female health. And the biggest one is called Vitex agnus or chasteberry, right? And this can be bought as a tea that you can drink every month. There's other herbs. I can't go into detail on all of them. They include like red clover, shatavari, black cohosh, holy basil. Holy basil is good for de-stressing actually as well. Nettle tea, which is, I think a lot of people are familiar with. Red raspberry leaf tea, wild yam, red maca root, and ashwagandha, oat straw, and evening primrose. Evening primrose actually people take as a capsule, like an oil capsule, right? And if you're trying to take any of these in a therapeutic level, then it's better to consult a natural health practitioner or an herbalist who can guide you. You don't want it to be taking like therapeutic level, meaning really high, really high dosage of any of these herbs. They are like medicine, right? So don't treat them any differently than taking pills or something like that. If you're taking therapeutic levels, just having a tea bag is fine, right? Do herbs help with low ovarian reserve? It might help with aiding in your ovarian health and eggs, right? So I don't know about reserve because your reserve, like your eggs are created when you're still in your mother's uterus. Your eggs are already formed and in your uterus from that time. So the number of eggs you're ever going to have is determined before you're even born. So the issue is not about how many eggs you have, it's the health of those eggs that matter, which the diet and these herbs might help with, inshallah. And then supplements. There's some supplements that can also help, in particular, vitamin D3 combined with K2, vitamin E, folate, the natural folate, not folic acid, other B vitamins besides folate, so like B12, and the rest. Iron is really important. Ubiquinol, anyone asking about egg health and that kind of thing, ubiquinol is a huge one that you should look into. And another one is called acetyl L-carnitine. So I don't know if I can type in this chat box. Yeah, it seems I can't because it's connected to YouTube, right? So there's one called acetyl L-carnitine, sorry. So I didn't have all of these written on the slide. I apologize for that. Maybe I can send a list separately somehow, inshallah, or you can try to write down the names. So there's ubiquinol and acetyl L-carnitine, these two in particular. If you're having issues with ovarian health or your egg quality, you might want to look into omega-3 fatty acids, which comes from seafood, mainly, or you can take capsules, another really important fat that you need. And then also like selenium and zinc. And all of these you can research separately to see if it applies to you, if you have a deficiency and want to take supplements. On top of all that, of course, there's probiotics and other things to help with your microflora and gut health. If you're prone to getting like a lot of vaginal infections, yeast infections, and that kind of thing, then you should look at your gut health as well and restoring your microflora. So if your microflora is not good in the vaginal area, most likely that's the case for your whole body, including your gut. So you want to look into that as well, inshallah. Again, I can't cover everything in detail because we're actually past the hour. So let me try to go quickly now. Movement. So we should be active daily. That means light exercise like walking, swimming, even doing housework, going up and down the stairs. Now in pandemic, some of us are stuck at home, just vacuuming, dancing with your children to nasheeds, whatever it is that you're going to use to engage different muscle groups, encourage circulation throughout your body. Really, really important. And avoid sitting for long periods. So even like today, if I'm doing the webinar, I was sitting this whole time, which is not good. I should have gotten up in the middle to have a break, right? So every 20 to 30 minutes, you really want to stand up, walk around, jump up and down, chase your kids, do whatever it takes. But you don't want to be sitting for too long because your body actually kind of shuts down and it can affect your hormonal balance as well. So you want to avoid sitting too long and be active daily. Oops. Sorry, something happened here where my screen went all wonky. I think my slides were lost. Why did it get so big? Okay. Hold on for a technical minute while I get this back up for you guys. Okay. Oops. I think that should do it. So that's back up now, right? Okay, so get active daily. Avoid sitting for prolonged periods. So we did that. Okay, and then sleep. Another really, really important aspect of maintaining hormonal balance is trying to sleep, having good quality sleep. So you should be aiming for those 8 hours. I know some people are more used to 6. Some might even want 9, but generally at an average is 8 hours. And trying to go to bed before about 11 p.m. so that you're not interfering with your circadian rhythms, inshallah. So hormones are affected by staying up late, right? And I can't go through all the details, but there's other hormones that play when you stay up late. There's the serotonin, the melatonin, the everything. They're all like kind of in line with your progesterone too. It can affect that. The stress on your body and stuff, it can affect all these things, okay? And also you tend to eat more when you stay up late. Okay. And then avoiding light at night. So light entering your eyelids after you sleep can actually interfere with your hormones. So it's better to wear those eye covers, like an eye patch over your eyes, or even put up blackout curtains while you sleep. Even a little bit of light can affect you, especially that blue light, right? So there's like night lights I got that were red lights, and those are useful. So you can just enough light to see, like to use the bathroom or to take care of a child who's crying or whatever it is, just enough light to see, but it's not going to interfere as much with your health. So take a look at that as well, inshallah. And then stress and environment, another big one. Make sure you take care of yourself, reduce your stress levels. If you have a high stress life, you need to find time to do activities that you enjoy regularly and that help you relax. So stress, the cortisol and adrenaline and all these things have a really significant impact on your hormones. They tend to work counter to each other. So, I mean, like I teach birth classes as well, and we're always talking about oxytocin, which is like the love hormone, and endorphins, right? Like the happy hormone and all these things. So the opposite of those are the stress hormones. And so this will also interfere with your fertility cycle and all the hormones involved there. So hormones are all related to each other. There's a balance that you need to maintain, and de-stressing is one of those things you need to do. Also, avoiding hormone disruptors in your environment. So there's so many chemicals, which we call xenohormones, that are in our everyday things that we use in our house. And where you spend the most time normally is your house. That's the first place you need to look to start detoxing, right? So some of these ingredients like parabens you find in a lot of personal care beauty products. They're sort of like a preservative that's used, but they're very toxic. They interfere with your hormones. Phthalates, which are in plastic food containers, sometimes children's toys and things like that, right? Some of them say like phthalate free or whatever, but you can't be so sure. So replace all your food containers with glass or ceramic or something else. These are just some things to look at. Synthetic fragrances, not only are they neurotoxic, so they can actually affect your brain, they interfere with your hormones. Some of them are endocrine disruptors, right? Pesticides. This is why I say try to get organic food if possible, or what you're using in your garden or around your house or whatever. And then even spermicides themselves can interfere if people use that when they're trying to prevent pregnancy, right? So all these things you need to take a look at what's in your house and try to detox as much as possible, inshallah. And then finally, the last thing is, in terms of this talk, that is your weight. So subhanallah, having an optimal weight, so the body fat ratio is optimized, your BMI would be between 20 to 24. And BMI is based on your weight plus your height, right? So of course, if you're tall, short, whatever, you'll look differently. The point is that your weight and your height are balanced. So between 20 to 24 is normal. If you go too much above that, you could be overproducing estrogen, and that's going to affect your cycle. Your hormone feedback cycle will be affected. Okay. And then if you're underweight, you could stop ovulating altogether because you're not even producing enough of the estrogen to begin with. So there's a lot of issues. Someone asked, oh, thanks for sharing that dua, mashallah. And then someone asked, how about perfumes, body mist, etc.? Yes, all of those with synthetic fragrances can all disrupt your natural hormones. So I don't use anything with synthetic fragrances at all. I've eliminated all of that from my household. But what I notice is other people tend to use a lot of, laundry detergent or cleaners or whatever with really strong fragrances, and they don't go away very easily. Like we get hand-me-down clothing or toys that other people have, washed and passed to us, and the smell stays for so long. It's so unnatural, and it gives me a headache, to be honest, because I've eliminated synthetic fragrances for so long that my body is just not used to it anymore. So subhanallah, definitely eliminate those. You can use natural essential oils instead and make your own fragrances instead of using these synthetic ones. You can make your own sprays very easily, inshallah. So you can look into that, inshallah. Okay, so that weight is the last thing. And we're like 12 minutes past 1 now. So here is 1 o'clock in Canada. So just to recap, what did we cover today? We covered everything that we needed to cover, which was your cycle and your body. As quickly as possible, I did it. The 3 fertility signs, hopefully you understand them now. How to observe and record those signs. You saw it directly on the chart, mashallah. And some quick tips for balancing your hormones. And I know that can be like a whole other webinar in itself for each tip, right? Each individual thing could be another hour-long or more webinar. So hopefully it was helpful, though, to get you started, inshallah. So here are some resources to look at. My main reference for this whole, all the information in this talk is from a book called Taking Charge of Your Fertility. It's quite a long book, but it has a lot of details. So if you're good at self-learning and reading through this, then I definitely recommend you get it right away and start reading. It gives you a lot more examples of different types of charts and different things that people have seen in their chart and how to interpret that, inshallah. So definitely check that out. You can just Google Taking Charge of Your Fertility. They have a website where you can get free printable charts. It comes in PDF as well as Excel sheets that you can download and fill in directly inside an Excel sheet if you want to keep it digital, right? So that's really cool. You can get the exact charts that I showed in this talk there. Alhamdulillah. And then if you're not into paper charts, you can use these tracking apps. So the one I use is called Kindara. I find it has all the features I need. I think there's just one, which is the vaginal sensation, that you have to pay to get the premium version to use that part. But it's not a big deal. You can just write it in your notes. Like there's like a little note section. So I use Kindara. There's one that I've seen recommended by other women who do FAM called Read Your Body. This one is run by a nonprofit. And so there's like a monthly subscription of like $2 or $3. I think that's Canadian dollars. So maybe it's a bit cheaper in America. But, it's not very expensive. Or it's about like $20 a year. Mashallah. And a lot of people like that one a lot. I think because they like the people who created it as well. And then Overgraph, I've not tried at all or heard much about it, but it's the official one that goes with this book. So it's designed to really match the charts in the book, I think. I took a quick look at it. But anyway, you can check these out and see if they work for you. Kindara is pretty much free to use all the main features, and I like it a lot. It's really easy to use, alhamdulillah. And if you want support, you're self-learning, but you want support, then you can join a Facebook group. It's called Fertility Awareness Method of Birth Control. It has over 30,000 members worldwide. It's not a Muslim one. It's just an open one for women. And so if you join that, you can get a lot of tips. You can post your own charts, and women can help you interpret, the more experienced women. And I just find that really useful when I was starting out. So you can look for that group as well, inshallah. And you can find a teacher. So this link has a teacher. Sorry, it has a list of, I guess they're certified teachers who certified through different methods. So you can find this symptothermal method there, and there's a few others that are similar. And then there's some that are totally different as well. But anyway, you can find a teacher if you feel better learning with a person instead of reading on your own, inshallah. And I actually have a friend who I think might be starting some courses soon. She's really good at all the different fertility awareness methods, inshallah. But she doesn't have a link yet, so I couldn't share that. Anyway, alhamdulillah, these are the resources for you, inshallah, that you can check out right away. And you can start charting right away if you download one of these apps. Like starting today, you can immediately go and check your fluids and check your cervix, and then get one of those temperatures. Sorry, what was it called again? Thermometers, not temperatures. Get one of those thermometers and get started immediately. There's nothing to wait for, subhanAllah. If you don't have a basal one, then start with the regular one first until you get the basal one, just to get a sense of doing it, right? Alhamdulillah. So that's pretty much it. So we can open, I can stay for another 10 to 15 minutes for questions if anyone wants to stay. I know we've gone a bit longer. So I'll be here waiting, inshallah. So someone said, thank you so much, Sister Mona, for sharing your knowledge. Where can we find you? Do you have a personal blog or Instagram page? So I'm currently hiding in my cave working. So you can get my contact details, inshallah, from the team, the RYS team, inshallah. But I'm not active on social media at this time. Musina said, Jazakallah khair wa yaki for this informative webinar. It's really helpful. Wish you give more webinars like this. Alhamdulillah, inshallah. More people thanking. Alhamdulillah wa yakum.
Hello.
Yeah.
Can you hear me?
Yeah.
Sorry, I'm always checking. Okay, so you were Jazakallah khair. It was very informative, very insightful, and alhamdulillah, you were answering a lot of questions on the go. The questions that came through the chat box. We have a question that came anonymously through a private message, and the question is: what are the pros and cons of these two birth control methods, health-wise and also Islamic views? So the methods for women, a tubal ligation, and for men, vasectomy.
Yeah, so tubal ligation and vasectomy. So let's first talk about tubal ligation real quick. So the only problem is it tends to be permanent. So if you change your mind, you can't, have kids later, subhanAllah. It does work. I think less than 1% of women experience failure, but it also can fail. So it's not completely foolproof. There was a story I heard of someone in the Emirates. There's a sister who did everything. I think she got the IUD, tubal ligation, and whatever. And no matter what, she would get pregnant. So it's like if Allah is just saying, kun fayakun, He says be and it is. You're gonna get pregnant, like even if you try your best. And so the benefit would be that you don't have to remember to do anything. I guess that's pretty much it. It's just because it's kind of permanent. You don't have to take a pill. You don't have to use a device or insert anything else. But there's a lot of risks. So there's a higher risk of ectopic pregnancy. So it's like where the fetus, you still get pregnant, but the fetus gets stuck in your tube instead of in the uterus. And that can be life, you can risk your life because of that. It's pretty dangerous. There's always risks to any kind of surgery. It's a surgical method. So surgical risks include bleeding, damaging other organs, damaging blood vessels, damaging your bladder. Similar to like if you get a C-section, right? There's a lot of risks to that as well. There's some syndromes you can get after that. You can get hot flashes, sort of like menopause-like symptoms. It can affect your hormones as well. So you can get the hot flashes, night sweats. dryness, trouble sleeping, a lower sex drive, irregular periods. You might have really painful periods. So there are a lot of risks, especially if you are overweight or you have any other health issues, chronic issues, then these risks are even higher. Yeah, subhanAllah. And then even to seal the tubes after they've done that, they might use electrical currents or something, and you can get burned. So that's like another side effect you could have, subhanAllah. So I would not, recommend doing that. Of course, do the research, pray istikhara if you're considering that. For men, similar vasectomy, the same thing. They can experience pain. They can have failure as well. They can have certain conditions that come up because of this procedure. It's like a fistula. So it's kind of like a hole that happens between the different tubes down there. I can't describe all of it. But anyway, fistula is usually like a hole. So there's different complications that can happen for the men. They can have discoloration, extra bleeding, infection, swelling, and it can fail. It might not even work after all that, pain and stuff. Islamically speaking, tubal ligation and vasectomy, I think generally speaking, the scholars say it's not allowed unless there's a life, like a life-harming issue. So your life is at risk. You can get harms. So if a woman, like if she were to get pregnant and she might actually die from it or experience severe harm, then that would be sort of the only excuse. For men, I'm not sure what excuse there would be in terms of health-wise to get a vasectomy. But for sure, consult a scholar if it's something that you're seriously considering to make sure, you fit in that category of it being allowed. But generally speaking, it's not allowed. It would be considered haram without need, subhanAllah. And so it's changing the body from what Allah has designed us to do. So if you just follow fam or, just abstain or whatever, that's probably better than doing something like that permanently to your body that can have consequences that you cannot reverse, subhanAllah.
Jazakallah khair. And we have Sister Aida asking, I'm having back pain. Does that relate to hormones or what?
Back pain can be due to a number of reasons. It can be due to your alignment as you move and do things throughout the day can cause back pain. Stress can cause back pain, emotional or otherwise. If you're being stressed, feeling any type of stress in your life, it can come out as a pain in your body, right? And so engaging in sort of emotional freedom techniques or relaxation techniques might help alleviate that pain. It could just be from moving in a funny way, you hurt yourself as well. So there's a lot of things. Hormones could be part of it, but I don't think it would be 100% just hormones. There might be a lot of different things happening together to give you the back pain. So you need to investigate what's happening there, especially if it's chronic. It could be a chronic stress. There's some people who experience actually like emotional trauma or like a grief, like someone died in their family or whatever, and they never had time to really get over it or release that trauma from their body, and it can manifest as a pain in their body as well. So depending on your life situation, I don't know you personally, I can't really evaluate what's going on. But you can look at all these different things happening and see if it might be one of these things triggering that pain. But hormones could play a part. But remember, hormones reflect your overall health too. So if your overall health isn't great, then it will affect your hormones and vice versa. And that can also create pains in your body.
Jazakallah khair. And one last question. Conception is possible with uterine tuberculosis, right? Is it possible?
I'm not familiar with uterine tuberculosis, so I think that's something you would need to check with a healthcare provider or a specialist who knows about this. I think conception, no matter what, is possible with Allah's help, subhanAllah, as long as you're producing eggs and you're trying to take care of your health, then inshallah, anything is possible with Allah's power and will, subhanAllah. But of course, if it's interfering with it, it's not optimal, then you have to get that taken care of as well and find out what you can do to improve the chances of conception, inshallah. The same with PCOS. So many women I know who've managed the condition were able to get pregnant, And there's sort of this myth that if you have it, you can't get pregnant at all, which is not true. As long as your body's producing eggs that are healthy enough to get pregnant, it's possible. But it's just the environment, as you saw, the fluids, the hormones, and everything have to all be conducive towards getting pregnant, right? So all those things need to be healthy and normal, inshallah.
Okay, we said one last year. I think this is supposed to be the last one, inshallah. Sister Rabia kept saying, can you please answer my question too, inshallah? So if there are cysts in the ovaries due to PCOS, will the cysts come out during next menstruation? Also, will the cyst be a barrier for the formation of healthy egg?
I'm not an expert on PCOS, so I can't answer in detail, but I don't think the cysts actually come out. I think they can resolve, and sometimes they might need to get treatment, specific treatment, but I don't think it's a barrier necessarily. Like, as I said, as long as you have the eggs there and you're taking care of your health and you're doing everything that you can to help yourself, like have the optimal conditions to conceive, then inshallah it can be possible. So even if you have cysts, don't think that's it, you can't get pregnant. I don't think they come out in menstruation though. I'm not 100% sure about that.
Yeah. Jazakallah khair for your time and effort, Muna. May Allah accept it from you and make it weigh heavy on your scales. We have a lot of sisters sending their messages of gratitude. We just have 2 more news to announce. This webinar was funded by Alif Foundation, and this was our first ever sponsored webinar. MashaAllah. Allahumma barik. Team RYS is really happy. So Alif Foundation is a community initiative that was founded in Chicago, and they empower, support, and connect the community and provide programs and services. And they also support charitable organizations around the world. So please give them a follow and support them in any way you can. I'm sure the links are being shared in the live chat box. And again, we would like to thank Alif Foundation for their generous sponsorship and sponsoring this webinar. And as you know, RYS hosts a number of community services such as Monday Musings Parenting Podcast for Muslim families, and webinars weekly on Wednesdays, and also free digital library. So if you'd like to support in any capacity, please get in touch with us, or you can just send your contributions via the link on the website, inshallah. And the second news we have, which has nothing to do with the webinar, by the way, but it just happens to be the day we are launching a new course. So I'm just making a great big announcement with our live community here. So this course, which I will be delivering, inshallah, from Passion to Prevention, Launch Your Own Online Course, is for all Muslim women who have a burning desire to launch their passions into profession in the shape of online course. So as you know, RYS was founded as an Islamic online academy for all talented Muslim women to come and share their skills online. Right, inshallah. So if you want to develop, design, and launch your own online course, this is the right course for you, where I will be covering a number of things like curriculum development, syllabus design, scope and sequence, and how to put the course together, finding course title, and where to deliver. We will also be exploring different softwares and platforms to launch your course. So it's a personal invitation where I will be holding you by hand and walk with you step by step in the process of launching your own online course, inshallah. So you can sign up via the link. I'm sure that, again, the links are probably being shared. And yeah, I will see you on the other end, inshallah. Or if you know of anybody else who want to launch their online courses, but they don't come from maybe education background or teaching background, and they need help to put their course together, then this is the course where I help women to develop and design their own online courses, inshallah. Once again, Jazakallah khair, Muna, for your time, and it was really
Wayakum.
informative. I was taking notes and it went over 4 pages.
MashaAllah.
I was like, oh, I need to listen again.
MashaAllah. I put a couple of links in the private chat. I don't know how it gets to everyone else. The link for the charts, the link for the directory I mentioned, and also my Facebook, my professional Facebook account, if people want to connect there. I put it in the private chat on this StreamYard. I don't know if you guys can get it to people, inshallah.
Yeah, maybe Sister Aisha can copy and share in the live chat box, inshallah. So, yeah, you can get with Sister Mina on Facebook, get in touch with Sister Mina on Facebook, inshallah. And Jazakallah khair for attending today's webinar. And we look forward to seeing you in our future webinars, inshallah.
Inshallah.
وبحمدك أستغفرك وأتوب إليك. السلام عليكم ورحمة الله وبركاته.
Wa alaikum assalam wa rahmatullahi wa barakatuh.